Welcome to Suite 250 at Cool Springs Foot Care. My name is Dr. Lance Reeves, and today I wanted to talk about plantar warts. Plantar warts are actually the human papillomavirus, or the HPV virus. This can affect the plantar or the sole of your foot and present as tiny growths with sometimes little black dots in the center of those growths. Unlike other warts, plantar warts can be super uncomfortable because they're on the sole part of your foot, so anytime you're walking, that's going to be causing pain with each and every step. Plantar warts are contracted from direct contact with the virus. That means that virus has to come into contact with your skin in order to get into the body. This can be especially prevalent in people with weakened immune systems, a lot of barefoot walking in public. Small cuts or abrasions are also a very good avenue for warts to get into the body. Anytime there's a cut in that skin, that's a direct avenue where that HPV virus can get into the skin. Plantar warts always start as a small lesion that sometimes doesn't cause any pain, but then as it grows, that lesion is going to cause a lot more pain because each time you're walking on that foot, that's going to be pressure directly on that plantar wart. Three things that I like to look for when I'm evaluating plantar wart is 1. Interruption in skin lines. If there's an interruption in the skin lines or a cauliflower type appearance to the skin, there's a good chance that that's a plantar wart. If there's not an interruption in skin lines or there's no cauliflower appearance, that sometimes can just be a corn on the bottom of your foot and not a wart. The second clinical sign that I use is pain with compression. If you squeeze that lesion, that's going to cause a lot of pain if it's a wart. On the other hand, if it's just a corn, squeezing that lesion is not going to be as painful. The third thing I use is what's called pinpoint bleeding on debridement. This means if I shave that top layer of wart tissue off with a blade, that's going to cause some tiny pinpoint bleeding because warts are such a vascular lesion. This means that there's a lot of blood flow getting into that wart tissue. That's why it can bleed so easily. So if you see a cauliflower type appearance, which means an interruption in that skin line, if it's painful when you squeeze that lesion, and if you notice it bleeding very easily, there's a really good chance that that's a plantar wart. There are a lot of different treatment options for plantar warts, ranging from over-the-counter to more advanced treatment options. Two common options that you see a lot of are salicylic acid or cryotherapy, which is freezing the wart. Both of these options are what's called destructive treatment of that wart. That means it is a destructive measure to try to kill that warty tissue. Whether it's salicylic acid or the freezing option, both of those are going to cause a burn on the wart, but it's also going to cause a burn to all of that surrounding tissue. So the healthy skin around the wart is also going to be burned by either that salicylic acid or the freezing treatment. Let's start with the salicylic acid. This will go on the wart tissue and the surrounding tissue, and it will cause a burn. Over time, that skin will turn white and you'll be able to slough that off, and you'll still be looking at that wart. This needs to be done very consistently, sometimes for months and months and months, before you start to see resolution of the wart. In some of the worst cases, you can treat this for months with salicylic acid and see no difference, or the wart could actually get bigger. Freezing is another option. If you freeze the wart, it will cause that burn due to the low temperature, and then that burn will cause the skin to blister, scab, and fall off, and then you're still going to be looking at the wart. You're going to have to continue to do these freezing treatments over and over until resolution of that wart. Again, this can be really difficult because you will have to do this freezing treatment for weeks, sometimes even months and months, just to get that wart resolved. And in some of the more difficult cases or larger lesions, that won't even come. And in some of the more difficult cases or larger warts, that freezing won't completely get rid of that wart for you. The tricky thing with the salicylic acid and the freezing treatment is it is a topical treatment that treats the top layer of the wart. Because warts are so vascular, they have roots into the deeper layer of the skin. Because they're such deep lesions, you have to continue to treat and treat and treat to try to get into the deeper areas of the skin to kill that wart tissue. If you have a very small wart, I think the salicylic acid or the freezing treatment is a good option because it's not as large and it should be quick to get rid of. But in some cases, the small ones can be difficult to resolve as well. There is a surgical option to get rid of warts. This means you actually cut out the wart with a blade and remove it. This is something that I don't recommend because anytime you cut the bottom of your foot, that plantar skin, the incision can cause a lot of scarring, and this can be uncomfortable for patients. Another thing to be aware of is when you start to remove skin on the bottom of the foot, what does your soft tissue envelope look like for the surrounding skin? Because if you cut out a hole, you need other skin to close that incision and close that wound. If that's not done properly, that can cause an increase in scarring or contractures along that skin line or in different parts of the feet. Surgical excision for plantar warts is not something I would ever recommend to patients because it can be painful, produce a lot of scarring, and it's no guarantee that that wart is going to be gone for good. It could always come back. Cautery is an option. That means you actually burn the warts. How does that sound to you? I can't think of many people who want to have warts burned off of their skin. To me, that sounds pretty terrible, and I also think it probably is going to smell terrible too. One option that I'm proud to offer is a one-of-a-kind swift microwave technology to get rid of warts. This actually uses your body's own natural immune system to kill the wart. This requires no salicylic acid, no freezing, no cutting, no electrocautery, nothing like that. This works by briefly heating up the wart tissue, unlocking a heat protein in the body, and this signals your body's own immune system to fight and kill off the wart naturally. This treatment has a lot of positives in that it doesn't cause any destruction to the healthy surrounding skin. After the treatment, you will notice no burning, no pain from the treatment process. This is done once a month for 3 to 4 treatments, and all of the treatments last less than 10 minutes. In between those treatments, the patient has nothing to do. You don't need to apply creams, you don't need to do at-home freezing. You come to the office, you get your treatment, and you go home and let the body take care of itself in killing off that wart. As far as preventative measures for warts, I think it's important to practice proper foot hygiene, try to avoid barefoot walking in public places, and if you do see any suspicious skin lesions or growths on your feet, come to the doctor right away to have those checked out. If you have any questions about plantar warts or feel like you would be a candidate for Swift therapy, please call the office at 615-567-5622 or visit us online at coolspringsfootcare.com. Thanks so much for watching this video. If you found it helpful, please like, comment, and subscribe to our channel.